Welcome to Good to Know, where we dive deep into the science behind everyday questions. Today, we're tackling a huge one. Is vaping really safe, or is it more dangerous than we think? You've heard the marketing, you've heard the debates, but what does the latest research actually say? Let's take a clear-eyed look at the real science behind vaping, your health, and your future. When e-cigarettes first hit the market in the early 2000s, they were marketed as a safer alternative to smoking. The logic was simple. Traditional cigarettes burn tobacco, producing thousands of toxic chemicals. E-cigarettes vaporize a liquid, producing fewer harmful byproducts. At first glance, that sounds like a healthier choice. But as vaping became more popular, especially among young people, scientists started asking deeper questions. What's really in that vapor? How does it affect your lungs, brain, and heart? And what are the risks of long-term use? The answers, it turns out, are complicated and sometimes alarming. Let's start with what's inside most vaping products. Vape liquids, or vape juice, typically contain nicotine, the same highly addictive substance found in cigarettes, propylene glycol, and vegetable glycerin. Chemicals used to create the vapor. Flavorings, from sweet fruits to menthol to dessert flavors. Other additives and contaminants, including heavy metals, formaldehyde, and ultrafine particles. When you inhale vapor, you're not just breathing in harmless water mist. You're inhaling a complex mixture of chemicals, many of which have unknown or poorly understood effects on human health. Let's focus on nicotine for a moment. Nicotine is one of the most addictive substances known. It alters brain chemistry, reinforcing the desire to keep using and making it extremely hard to quit. In young people, nicotine is even more dangerous. The adolescent brain is still developing. Nicotine exposure can disrupt brain circuits involved in attention, learning, and emotional regulation. Increase the risk of mood disorders. Prime the brain for future addiction to other substances. Studies show that teens who start vaping are more likely to move on to smoking traditional cigarettes, the terror phenomenon known as the gateway effect. In short, nicotine hooks you early and the brain damage can be lasting. What about the other ingredients? Heating vape liquids creates new chemicals that weren't in the original mixture. At high temperatures, e-liquids can break down into formaldehyde, a known carcinogen, acrolein, a chemical that can severely irritate and damage lungs. Heavy metals, like lead, tin, and nickel, often leached from the device itself. When you inhale these substances deep into your lungs, they can trigger inflammation, oxidative stress, and tissue damage. This leads us to one of the biggest concerns: lung health. You've probably heard about vaping-related lung injuries, officially called EVAL, or e-cigarette or vaping product use-associated lung injury. In 2019, thousands of cases of EVAL were reported across the United States, causing symptoms like shortness of breath, chest pain, coughing, fever, nausea. Many patients required hospitalization. Some died. The exact causes were complex contaminated THC. Vape products played a big role, but the outbreak made one thing very clear: vaping is not harmless for your lungs. Even outside of EVAL outbreaks, studies show that regular vaping causes airway inflammation, impairs immune defenses in the lungs, increases susceptibility to respiratory infections, reduces lung function over time. Inhaling vapor into your lungs simply isn't what human lungs were designed for. Then there's the issue of heart health. Vaping increases heart rate and blood pressure, just like smoking. Nicotine itself stresses the cardiovascular system. It causes blood vessels to constrict, reduces oxygen supply to the heart, and promotes clot formation. Another major area of concern is brain health, especially for young people. Beyond addiction, nicotine alters brain development, affecting areas related to memory, learning, emotional regulation. Research suggests that regular vaping may increase the risk of heart attacks, worsen blood vessel function, elevate the chances of developing heart disease over time. Although vaping might produce fewer harmful chemicals than traditional smoking, it's not a neutral behavior for your heart or your overall cardiovascular health. Disputating animal studies show that early nicotine exposure can cause lasting structural and functional changes in the brain. And since many vapers start during adolescence, this raises red flags about long-term mental health effects. Let's also talk about secondhand vapor. Just like secondhand smoke, secondhand vapor isn't harmless. While it may contain fewer toxins than cigarette smoke, it still releases nicotine, ultrafine particles, volatile organic compounds, heavy metals. Non-vapers, especially children, pregnant women, and people with chronic illnesses, can be exposed just by being near someone who's vaping. This raises serious public health questions about vaping indoors, in schools, and around vulnerable populations. So how does vaping compare to traditional smoking? It's important to be clear. Vaping is likely less harmful than smoking combustible cigarettes. Cigarette smoke contains over 7,000 chemicals, hundreds of them toxic, and at least 70 known to cause cancer. Switching from smoking to vaping may reduce exposure to some of those toxins and might help some smokers quit. However, less harmful than smoking is not the same thing as safe. Vaping brings its own unique risks, especially when used by people who never smoked to begin with. In other words, if you're a smoker trying to quit, switching to vaping might be a step in the right direction, if it's used as a bridge to quitting nicotine entirely. But if you've never smoked, starting to vape introduces entirely new risks that didn't exist before. And there's another problem. Many vapers become dual users, continuing to smoke cigarettes and vape at the same time, negating potential health gains. Vaping's impact also depends on what's being vaped. While many products contain nicotine, others deliver THC, the psychoactive compound in marijuana or other substances. Black market vape products, especially those containing THC, have been linked to outbreaks of lung injuries. Unregulated vape liquids can contain unknown contaminants, dangerous cutting agents, and wildly variable levels of nicotine or THC. Without strict manufacturing standards, users often have no idea what they're inhaling. What about long-term studies? The truth is, we don't fully know yet. Because vaping is relatively new, long-term effects like cancer risk, chronic lung disease, and cardiovascular outcomes are still being studied, but early signs point towards significant risks over decades of use. Based on what we know from similar exposures like smoking and occupational chemical exposures, many scientists are concerned that long-term vaping could cause chronic obstructive pulmonary disease (COPD), increased cancer risk, accelerated cardiovascular disease. The full picture will take years to emerge, but waiting for perfect evidence could mean ignoring serious warnings that are already flashing. So, what's the bottom line? Vaping is not safe, especially for youth, pregnant women, and people who've never smoked. It's less harmful than traditional smoking, but that doesn't mean it's harmless. Key takeaways from the latest science. Nicotine is highly addictive and damages developing brains. Vaping chemicals cause lung and heart damage. Secondhand vapor is not risk-free. Long-term effects are unknown but concerning. Quitting vaping entirely is the healthiest choice. If you smoke and can't quit otherwise, switching to vaping may lower but not eliminate your risks. And for those considering starting to vape, the clear scientific advice is, don't start. It's simply not worth the risks. Understanding the facts gives you the power to make informed decisions about your health, your habits, and your future. Have you had any experiences with vaping, positive or negative? Or are you trying to quit? Share your story in the comments side. Love to hear from you. If this video helped clear the air about vaping, like it, subscribe to Good to Know for more science-based explorations of health, habits, and the human body. And hit the bell so you never miss an eye-opening discovery. Knowledge is power, and your future is worth protecting.